So welcome everyone, I'm Réka Garai, and I am investigating pediatric viral infections, characterization of novel infections, and child-friendly approaches. I work at the first department of pediatrics as a PhD student, and I am also a resident. Our mission is to create child-friendly healthcare solutions and also reduce the burden of the existing pediatric long COVID syndrome. Our vision is to work in a creative, cooperative, open environment by developing standardized, modern, and patient-focused healthcare system. So here you can see our ongoing projects, which is the first is the characterization of pediatric long COVID syndrome, the second is the renewal of our ongoing registry, and the third is the investigation of nasal influenza vaccines in children. So the first one is the characterization of pediatric long COVID syndrome, which is now a new entity, and we started our registry in March. Long COVID syndrome means that these patients have ongoing or new symptoms for more than 4 weeks from the onset of the acute COVID disease. We know it from adults, basically, that it can affect multiple organ systems with a potentially negative impact on the quality of life, but we don't know it yet from children. Which makes it more difficult to investigate these questions that medical characteristics of COVID-19 related diseases in children is really difficult because, as you can see, they can remain asymptomatic in around 35% of all cases throughout the infection. Although we can say that long COVID syndrome can affect all age groups, and this is in the focus of increasing of numbers of studies in adults, yet its characteristics need to be described in children in the future. So we wanted to investigate this, and with our registry, we wanted to understand the clinical characteristics of this newly emerged condition to be able to create pediatric case definitions, guidelines, severity scores, clusters to be able to reduce the burden of this disease. Our hypothesis was that compared to adults, the acute COVID can be asymptomatic or mild in children, but we can detect similar lasting symptoms and connected conditions in these cases as well. We included 97 patients in our analysis based on the NICE guidelines case definitions, which are for adults and children as well. So we characterized them, and we investigated their laboratory, radiological, physical findings, the acute COVID disease, and quality of life changes. Here you can see on the right that we asked different questions regarding their quality of life, from being emotionally affected to being able to getting dressed, and they needed to answer it in a 5-degree scale from no difficulty to extreme difficulty, and we found that the majority of children, so you can see 73% of them, could report at least minor impairment to their quality of life. Despite the high number of these presenting symptoms and major impairment in their quality of life, we could observe connected clinically important conditions in a lower proportion. So our registry analysis is under peer review now at Nature Medicine. Our second project is the renewal of our ongoing registry. Here you can see it's standardized and it can be reproducible, and we are using the WHO's post-COVID CRF, and we are treating them based on the NICE guideline and follow up them until 2 years. Here you can also see the numbers of data from the first and the follow-up periods. We want to move our ongoing registry from Google Forms to the RapidCap system, and we would like to expand it to other universities as well. Our third project is based on the child-friendly approaches. So our main goal is that there is a pain-free alternative for the prevention of the influenza disease, which is really important because children under the age of 5 is a high-risk group. But live is only available for healthy children from 2 to 18 years. So we want to assess the efficacy, effectiveness, safety, acceptability, and cost-effectiveness of nasal flu vaccines compared to the injectable forms in all ages of children, regardless of health conditions. Why is it important? Because in pediatrics, we really love to facilitate the pain-free methods. So we would like to include only active, controlled, randomized trials, and our hypothesis is that these nasal influenza vaccine types are non-inferior to the conventionally administered forms, and with the use of this, we can achieve higher vaccination rates in children. So we conducted a systematic search, and now we have 60 eligible studies for full text selection. And quick overview of this project. We submitted our first project, and we want to finish the renewal of the registry in February and submit the meta-analysis in March. Thank you for your attention, and be yourself, everyone else is taken. Thank you, and I'm open for your questions.
Regarding the registry, it's a brand new registry because the COVID is just with us for 2 years. The question is, would you like to keep it this structure for a long term? I mean, this database?
Right now, yes,
yes,
but until we know, if we will know further, we can, yes, surely change it.
What kind of team do you have to support this kind of work?
Yes, really good question. We don't really have funding now, but we are trying to get one. Now we are PhD students and residents at the first department of pediatrics only.
You already checked the literature, I think, because of the preliminary research. Do you think that the long-term efficacy also will be the same for your intervention compared to the injected vaccine?
To the injectable form, they say, so as you could see, it's only in Europe, it's only available from 2 to 18 years, and they conducted lots of trials before, but it was placebo or not active controlled, and based on that, they said that it's more effective in children than in adults, but it's approved in America for adults as well. So it's the Cochrane review says that until we don't have active controlled trials, we can't really say more. So we will see. I hope it. So yeah, we hope.
Can you correlate actually the quality of life changes to the severity of the COVID infection itself? Is there a way for that?
No. Now we can't, because most of our children, so compared to adults, which they could get to the ICU and have these long-term post-ICU consequences, and we can call that long COVID as well, but we can't really see that much in children. So they had a mild or asymptomatic or a few cases moderate acute COVID, but we can see almost the same consequences in children as well. So it's quite interesting.
Even if moderate or light, it's still not nothing. I mean, in some of the children, I mean, there's just no obvious, I mean, they just screened and then they got. But whether there is a correlation between symptoms, short term and long term, I think this is still an open question.
This is a really good question. Now we wanted to characterize this disease, and there are no severity scores. So we want to make clusters after the first characterization, because there are no data or just really few cases in the international literature. And after creating clusters, we can think about creating severity scores. So maybe after that, if we have severity scores, because it's really not easy to determine which is the main part of the severity, if we want to choose that how many symptoms do they have, or for how long do they have these symptoms, or the quality of life changes depends on what. So this will be a new question.